Today's presenters are Mr. Marc Thibault and Ms. Stephanie Guzman. Mr. Thibault has been a consultant with First 5 Kern since 2008 and has supported various projects, including Resilient Kern and the Medically Vulnerable Care Coordination Project, and has facilitated various collaboration efforts, including strategic planning, and has co-led the ACEs Aware Network of Care Grant in support of First 5 Kern's efforts. Ms. Guzman is an LCSW and currently works as a mental health clinician for schools in Kern County. She received her master's in social work from USC and specializes in childhood trauma, and has made it her mission to educate other organizations about the effects of childhood trauma and children, youth, and families. She has provided training to over 7,000 educators all over California and is currently teaching hospital staff on mental health disorders and ACEs. And now I'll turn it over to Mr. Thibault.
Thank you, Diana and Patty, for co-chairing for us and helping Stephanie and me with everything. We really appreciate it. What we're going to be doing today is trying to cover a lot in a little bit of time, and understanding who has had some training in ACEs and who has not is going to be part of something we'll ask you to participate in. But I want to start off by saying you're under a banner of First 5 Kern today with this conference. And when you think about what this represents, it's almost 25 years that First 5 Kern has been in existence. It was funded through a proposition back in 1998 and approved by the voters of California. And it's actually brought over $200 million into Kern County to the programs that it's funded over these years. And I hesitate to think, what would we have done? How would we have acted through COVID if we hadn't had the strong community programs that were out there, you know, fully able to serve, but having to work from home. So First 5 Kern is huge in this. And Resilient Kern, which you're going to hear more about today, is an offshoot of that. One of the things that I want to make available to you that's included when you get the handout is a reference to Neurons to Neighborhoods. This was a pivotal study that really linked early brain development to the first 3 years, and we carry it with the first 5 years into kindergarten as a really seminal work that told us we really need to concentrate on children from preconception right up to age 5 and beyond. So when you get the link, you can click on that and get an executive summary for it. I think you'll find it very interesting. Next. So today's goal, the goals for today's sessions are to provide a definition of health equity. We've been hearing about that this morning, and how we can advance its principles in our day-to-day work and lives. We want to share an overview and a little bit of the future of Resilient Kern, the trauma-informed Kern County initiative, and its opportunity to build health equity through a variety of programs. And we include all of you in our future, because without all of us working together, we can't achieve that goal. Stephanie's going to provide a very practical example of how training teachers in trauma-informed practices can make a real difference in the educational experience and the lives of Kern County children and their families. And we want you involved. You can send us questions through the chat, and we want you to share any thoughts through the chat as well. Next. Next slide.
Okay, I'm going to go ahead and we have some questions. If you guys can go to Slido on your computer or on your phone and enter this survey number 993869. We have some few questions so that we can know who is in our audience today. So we'll give you a minute to go ahead and answer those questions.
So slido.com and enter the number.
Hover your phone over the barcode and it'll come right in.
your answers are going to help us kind of customize our responses and our emphasis of our program today. So what you can fill out will be very helpful.
So the first question is, what county are you representing today? And we obviously see that majority of you are in Kern. We have someone from Merced, specifically from Kern Behavioral Health and Recovery Services, Bakersfield. Someone from Fresno. I'll go ahead and share the results now, Mark.
Yeah.
Yeah.
So the majority of you are in Kern today. My answers.
Thank you, everybody, for sharing. I'm glad that we're kind of everywhere. That's really cool.
I'm sorry, we did test it and it worked earlier. So let's move on to the next slide.
All right, so we're going to be talking about health equity. And first I want to define what health inequity is. And what it is it refers to the differences in health which are not only unnecessary, unavoidable, but in addition are unfair and unjust. It's related both to a legacy of overt discriminatory actions on the part of the government and the larger society, as well as to present day practices and policies of both public and private institutions that can continue to perpetuate a system of diminished opportunities for certain populations. And there's one example that I will share, and that's the closing of a lot of our rural hospitals. Health equity means we should be providing access to care wherever we have people in our country, but the smaller hospitals are being closed at an alarming rate because they're not profitable. Unfortunately, there's no backup system that's been put in place. And so that requires people to travel long distances. We're fortunate in Kern that we have a strong backbone of services, but not every county in California, nor does every state have those. Now that's an example of health inequity. Health equity means that every person, regardless of who they are, the color of their skin, the level of education, their gender or sexual identity, whether or not they have a disability, the job that they have, or the neighborhood that they live in, has an equal opportunity to achieve optimal health. And when you think about inequities and health equity, we have folks that are being judged by their race, their language that they speak, their income. It could be their medical condition if they're obese. It could be gender, their lifestyle choices, their religion, and other signs of health inequity relate to pollution and water quality. So what we're trying to do through Resilient Kern is really balance that equation between, what the needs are and how we can bring to bear the proper resources to serve folks throughout our community. One example that I'll highlight is lead poisoning. And as I was reviewing our presentation just yesterday and thinking about the lead pipes and the situation that occurred in Flint, Michigan a few years ago, which is still reverberating today with the children who were damaged, their brains were damaged because of lead in their drinking water. There was a New York Times article published just yesterday about the fight that a lot of communities and organizations are putting up not to have to pay for lead paint in rented homes and lead pipes in those same homes. So it goes on. This is nothing new. It's part of basically a geography of inequity, if you want to give it a term. So let's go to the next slide. I'm not sure how many of you know about Resilient Kern, but it's a coalition of now over 80 different organizations that have been working for quite some time, working hard to bring all of our members of our community together from around Kern in a countywide effort through training, education, and action that can make a greater long-term impact on the lives of individuals, families, and our many communities. We started with something called Trauma-Informed Kern County. And it was a focus on having us all learn what ACEs are and what trauma does to families. It was part of our medically vulnerable care coordination project funded through Kaiser Permanente for several years. And then we were fortunate in 21 to get a network of care planning grant from ACEs Aware, which is a statewide initiative. We received a grant for $300,000, and it helped really bring to blossom the Resilient Kern initiative that we're part of today in this conference. Next slide. So let's start at the beginning. And I know you may have heard this even as of today, and certainly many of you have been through trainings before, but we want to establish kind of a baseline, and that's something that UNICEF really has championed around the world, and that's for every child to reach their full potential. And for them to do that, they need high quality health care and services, especially in those early days. So the time between pregnancy and age 3 is when the brain is most susceptible to environmental influences and is critical for a child's growth and development. Even children with disabilities and developmental delays, those living in poverty or deprivation, and those affected by conflict or displacement, as we're seeing now with the war in Ukraine, all children need nurturing care and health services to survive. And what we're trying to do is bring that coalition to bear here in Kern County. And we have been doing it for several years. We're hoping to get a new grant this year to keep that work going. So where did the idea of ACEs come from? Let's go to the next slide. ACEs refers to adverse childhood experiences, and they were first, I won't say discovered, that the links were first put together through a Kaiser Permanente doctor in San Diego working with his patients. And over the years in championing that research with the CDC, we came up with a whole body of work called Adverse Childhood Experiences, and have learned that it has long-term consequences across generations if that stress is not mitigated. One of the most important people that we've come to know through the Adverse Childhood Experiences grant work that we've done, but also because of her role as the former Surgeon General, Nadine Burke-Harris. That has been a critical set of information that we've learned over the last few years. She wrote a book called The Deepest Well, which I truly encourage you to read. Get it out of the library. You can't put it down. She's a pediatrician who, by working with her patients, found out that the 10 elements that we now call ACEs, from physical and sexual and verbal abuse to physical and emotional neglect, having a family member who is suffering from mental illness or is addicted to drugs or alcohol, or someone who's been in prison in the family, seeing a parent being abused, or losing a parent to separation or other reasons. She would see the effects of these on her patients and not know what was causing it. She didn't even have words for it until she came across the work of Dr. Felitti and Robert Anda from the 1998 study. And so in the last 10 years, she has really championed the whole idea of doing ACEs screenings in the doctor's office right up front and figuring out how families are affected by conditions in the home and perhaps going back a generation or two even, which causes generational trauma. Next slide, please. So what we've been working on in Kern with Resilient Kern and several other counties have been doing over the last couple of years, especially through the grant process, is we've been developing a cohort of physicians and providers like yourselves who have conducted screenings for the 10 ACE questions and engaged with patients and clients in what issues they've been confronting. So why does science recommend that we screen for ACEs? Because that's the new norm that has been brought forward through the Medi-Cal plan. Well, first of all, we know that toxic stress, which is what the worst case of stress is treatable. That it's the research, and now there have been millions of the ACE screenings conducted around the country, that it's evidence-based intervention. And that depending upon the type of stress, whether it's primary, secondary, or tertiary, toxic stress has different levels of prevention that we can impart in that process. It also provides a message of hope for patients and providers. It empowers individuals to take action in their own health. One of the things that it does is, especially as adults learn that they may have been through a lot and they may have blamed themselves, say, for their parents' divorce or for a friend's starting to use drugs and alcohol. They're not the reason for that. This is something that has occurred as a childhood trauma in many people's lives. And you heard earlier in the keynote that we have about 16% of our population, and not just in Kern or throughout the country, that have 4 or more of those 10 ACEs. And that can have a big impact on their physical and mental health. But the most important thing is that we want to break the cycle, the intergenerational cycle of ACEs. And that's the goal of the ACEs Aware work that we've been doing in California based on the Surgeon General's own experience. Next slide, please. So we've been working on a thing called Trauma-Informed Kern County. And so what does that mean? It refers to how our community thinks about and responds to children and adults who have experienced or may be at risk for experiencing trauma. We did some major training back in 2018 and 19, and we had a doctor who had been a pediatrician for over 30 years. And he participated in one of those cohorts of training and sent an email to me saying, this has really changed the way I look at my patients. Now, he's been working for 30 years. This is a big change in my experience, and I've worked with my staff as well for them to understand the impact of ACEs. The reason was they would have clients who would come in, patients, parents would come in and really be belligerent to the staff and give their staff a hard time. What they didn't realize, because they had not learned about ACEs, was the trauma that mom or those parents brought into the waiting room and into the examining room that they had experienced when they were children, and they're carrying that trauma with them every day. And so what we've been trying to do with Trauma-Informed Kern County is have people learn and understand the prevalence and impact of adverse childhood experiences in Kern County, the role trauma plays in our lives and across generations, and the complex and varied paths to healing and recovery. See, this is not just a message of doom and gloom, it's a message of hope. So what we hope to do, and we hope you're doing it already if you've had that, what we call that aha moment when you learned about ACEs, is shift the conversation from what is wrong with you or wrong with that patient to what happened to them. And maybe we should have conversations for them to gain that trust so we can start to work more closely with them. Next slide, please. When we think of trauma, there are two types, and I won't go into all of this, but if you think of a tree having all the branches, that's what we call the adverse childhood experiences above the ground. Those are the things that we may be cognizant of. What we're not necessarily aware of is the adverse community environments that we live in, from poverty and discrimination, racism, poor housing, the violence that we see and hear, the lack of opportunity, both economic mobility and social capital, things as easy to fix as poor transportation are part of adverse community environments. Imagine a parent who wants to take their child to their clinic, their doctor's appointment, and they can't get there, and they miss an appointment, and the pressure that it puts on them and the guilt that it puts on them. One of the biggest things that happened in Kern County was when the Valley Children's opened its big clinic on the west side of town, and it reduced the number of trips that families had to make for normal checkups from that 2-hour each way trip to maybe a half-hour bus ride or car ride to the west side, get that over with and be home again. That's a sample of how you look at a community environment and what's available, what resources are made available to help families. Next slide, please. A closer look at toxic stress includes the social and physical determinants of health. And I won't go through all of these. They're what we've been talking about: availability of resources, access to healthcare, the quality of education, which Stephanie's going to talk about, public safety, cultural isolation. We have folks who are immigrants here, migrants here, who may not speak the primary English language, but they have a full culture at home. Maybe your volume is down on there.
No, it's all the way to 100.
This was working, folks. Share your sound, it says. No?
No.
Okay.
Yeah.
It's a really cool video if you haven't seen it before. When you get the presentation, you'll be able to run it. So, I told you we were going to cover a lot quickly. The ACE score of 4 or more can dramatically increase risk for 9 out of 10 leading causes of death. This is a very common slide that is shown, and it bears noting because we can increase, based on the stress that we carry, our heart disease rate by 2.1%, or times, I should say. Suicide attempts, incredibly much higher. COPD, stroke, Alzheimer's, look at that number, 4.2, and diabetes. And a lot of these conditions we see in the newspaper everywhere. They're not just in Kern County. Unfortunately, Kern ranks 53 out of 58 counties in California health rankings. And so that means we really do need to work together over the next few years to bring these numbers down, reduce the number of ACEs that people experience. Next slide, please. One of the things that it does is it shortens lifespans. And here's a slide. It's a little older from Kern County, but when you look at the dark brown areas, they are living anywhere from 10 to 12 years shorter on average in those areas. And the gradient from dark to light yellow is quite stark. And that just emulate or illustrates the importance of doing ACE screenings everywhere with all the population so that we can get at the root of issues and start mitigating these conditions as early as possible. Next slide, please. One of the things that we've learned through research is that health is not only related to our genes, that as you can see, almost 50% of health is related to physical and environmental issues like air and water quality, housing and transit, as we've talked about before, and then social and economic factors, education, employment, income. The other 50% are related to the access to care and health behaviors like tobacco use and diet. And what we've learned through the ACEs research is that people who have had experience with a lot of ACEs tend to have more self-destructive behaviors. So it's very important that we have what we call the Kern Connected Community Network, which is something that we've had in the last couple of years here in Kern, is an online system. There are about 85 different programs that participate, work with clients, and make referrals to the services that the families need. So if you haven't heard or researched the KCCN, please do. Next slide, please.
Would you like me to click on that link, Mark?
Yeah, let's not right now. We're getting
Okay.
behind time. Thank you. So if you have a high ACE score, are you doomed? No. Resilience is our ability to bounce back. And the good news is the brain is plastic. So although there are risk factors, there are also protective factors. Next slide, please. The key protective factors really relate to people, the relationships that we have, the parental warmth and monitoring. It can include safe neighborhoods, the resilience of our own parents, and real concrete support in times of need. And that's what you all do in providing services. It can be as important as having a good teacher who spends time with a child growing up, or a coach, or an aunt or an uncle, or a faith community or cultural traditions that people live by that really help them overcome a lot of the challenges that they face. Next slide, please. So this is a quick graphic to say that we can build that community resilience if we have a shared understanding, if we have partnerships, that we look at this as a community-wide challenge or initiative, and that we provide the kind of training and support and funding that will help us develop and expand our state of readiness as a community of resilience. Next slide, please. Again, this is a nice short slide that I encourage you to keep available to you as you meet with clients, as you look at the issues in the community. This captures some of the key areas from economic stability to our healthcare system. It includes neighborhood and physical environment that we've been talking about, the education system, food access, as well as the kinds of social supports in our community, the type of reaction to discrimination that we might see and may be able to play a role in mitigating. Next slide. Some of the things that have been pointed out through Dr. Burke Harris as Surgeon General, through her clinic, and now through ACEs Aware, are these evidence-based buffering interventions. I hope a lot of you are getting out and walking again, getting out into the parks, getting some quality sleep, but good physical activity, mindfulness with a balanced diet, and that can really help support your own mental health and keep your supportive relationships strong. Those are called buffering interventions, and they can be practiced in minutes and short time periods to really give you a little bit of a break from the hectic days you have. Next slide, please. One of the things that we've learned about is that it's important to have a third place. You can have a workplace, a home place, but it's also important to have a place where you can meet others. And with COVID coming hopefully to an end, we can get back together in restaurants or bars or go to church again, really celebrate life. And that's been done over thousands of years in different places. Now we have a lot of online things. And I know my own grandkids do Minecraft and do them in groups. And that really has been a great thing for them during the pandemic when they were kept from seeing their friends. So today we're able to get together because of Whova and a Zoom meeting. But it's not a substitute for the face-to-face that we all hope to have. But it's important to recognize that we have that third place that we can hang out with our friends and our family and really reduce our stress level. Next slide, please. I mentioned it's important also to understand the environmental conditions. One of the things that we've learned is that if we have a solid social infrastructure, we can really mitigate a lot of the stress that people carry. And this is a book you can reference that, research that. Next slide, please. So one of the things about our social infrastructure are our libraries and our parks. Next slide, our pools. We also have in the Bakersfield City School Districts our wellness centers. They're located right in 4 of the schools right nearby, and kids can be seen there, get their shots, be checked out by nurses. What a difference when those are available right then and there in the school. It's something we should expand upon to all schools. Next slide. And then I want to close with a few of the resilience building strategies that we've learned to work. The trauma-informed approaches that like Resilient Kern. You heard earlier from Tom Corson about, if you didn't know before, about Kern County differential response, which allows CPS to respond differently to accepted reports of child abuse and neglect and help the family get through a traumatic period and not remove their child. Our community arts programs are critical to all of this. Next slide. Our community centers, when you hear about a library or a community center, perhaps their hours being cut back or closed, we need to fight for those to stay open, to give that place, that resting place for people. Our program at Clinica Sierra Vista, the medically vulnerable infant program, is one that's an early childhood home visiting program that works. It's scientifically supported. We have father involvement programs and working with fathers to learn how to parent sometimes or to meet other fathers. We've got First Five has funded nurturing parenting, group-based parenting programs for many, many years. They have been fabulous in helping parents. Next slide. And we heard earlier today the mental health first aid program that the Behavioral Health and Recovery Services provides. You may belong to a neighborhood association. And I think we have a Daisy here with the Nurse Family Partnership, which has been going for 35 or more years, helping first-time moms in Kern County during their first pregnancy and continuing through their second birthday. Those programs that I've just shown are resilience building strategies. But when we think of Stephanie's programs, they are right there in the schools. Let's turn it over to Stephanie.
Thank you, Mark. So I'm going to be quick here, but what I want to make sure that we're kind of putting together and piecing all of this information in a way that kind of promotes educating our educators. Our educational systems are part of the interlocking effects of all of things. So when we think of someone's, from an ecological perspective, all of the things that touch onto someone, we think community, people, places, and all of these other things too. So these are more of a positive approach to looking at how to build upon resiliency. So let's look at all of the other things as it pertains to school. So next slide. Thank you. We want to build community resilience, and the best way for, one of the best ways to doing that would be to build upon our school systems, meaning we're bringing trauma-informed knowledge to our schools. This I'm aware of, and I think we're touching on getting that awareness and providing and instilling like a basic foundations, but it requires a lot more. In order to really promote resiliency, we need to educate them in not only the foundations, but the implementation, the strategies and things like that. So these steps here I put together because I was thinking in a way for us to continue with sustainability, because we have educators saying that, okay, we understand it, but what do we do about it? And more importantly, I feel that if we bring a self-awareness component to trauma-informed care, we can then not only help support the helper in understanding themselves and their own response system, then we can better serve our students. Next slide. So this is just a little bit of information in regards to what we have done so far. I feel that when we get this out, we're bringing in awareness, we're teaching them about all of these resources. But remember, when someone is in survival mode, the last thing that they are thinking about is generally the resources or things that are in our community. They're thinking about our basic needs: housing, food, air, sleep, things like that. So we want to be able to provide these ways of having not only the families and the children have safety and stability and have a way to regulate, but also then provide the resources. And the way to do that is to ensure that we are educating the educators about those stress response systems, the responses to what that looks like, the symptomology. Next slide. So when we think about it from this perspective of a trainer, right, where the overall goal is to provide knowledge, understanding, and strategies. The goal with that, again, is to ensure that when we're educating them, we tell them why. The why is very important. Why do we want to do it in the schools? Well, not just so everybody can know, no, so that way we can bring forth a procedure that helps support resiliency for one, and for two, provides safety in a way that helps children heal from developmental trauma. And when we do those things is because we're providing a space where we know that children spend the majority of their time. And so next slide, and I'm going to connect it here soon, but we know that children are there. We know that families go to schools for resources too. When families, and this is from my experience, when families are in a very stress-related circumstance, the first place that they often think about going for resources is a school or a hospital, right? And so when you think of that perspective, we can think then, okay, how do we make sure that we are prepared to help support them when they do come looking? So a family comes and she's like, I'm being evicted from my house. I don't have a job. I don't have any money and I have 3 small children. I'm scared. I don't know what to do. If our staff in the front office are trained in understanding that, okay, we are here, we understand what ACEs looks like. We know that these children are experiencing stress too because the mom is experiencing stress, then we can respond better. We put in place better procedures and policies to help support the family holistically. Next slide. I'm going so fast. When I connected to our ACEs pyramid here, The reason, again, for the justification behind educating educators on ACEs and response systems, we need to understand the significance that the ACE study has as it relates to education. So children who are exposed to multiple ACEs are overloaded with stress, which leaves them in this constant state of survival, right? And when our survival part of our brain is activated, we turn off the part of our brain that is there for learning. Therefore, it makes for the absorption of anything new really difficult or nearly impossible. And over time, with continuous experiences of adversity, the brain becomes disrupted. So we understand that not only are we at a disadvantage when we're experiencing ACEs, but we're also hindering our future in that area as well. And so the school is one of the better places where we can support students, not only for future, but in that current moment. And so that is why I feel educating our school systems on these types of trainings and implementation of new strategies is our best route in ensuring resiliency through our community and the overall lifespan of our children. Next slide. This I put here because, for one, again, when we bring perspective, why do we want to teach? And I really was asked this question recently. Why do the front staff need to be trained in trauma-informed care? That's for the teachers only. No, every adult who interacts with a child is a potential supportive adult. That is one of our key factors, our key protective factors at ensuring, healthy relationships are established between an adult and child, which again is the buffer against ACEs. And so the strategies for healing developmental trauma are actually very simple. They're connection. Not only is it just connection, but relationship. The art of being seen, being heard, having our basic needs met, which the school does meet naturally, right? We feed them, we provide safety. Well, going that extra step is getting that connection between relationship. The domains that are impacted by developmental trauma is attachment, is relationship. So those children who need it the most are the most difficult to reach. But of course that they are, because those parts of the brain are impacted. And therefore it requires more work, more opportunity for them needs to be given, and more understanding, and therefore more, how would I say exactly like this? The educators, when in the school system, need to be better equipped at understanding what that looks like, what resistance looks like, what ambivalence looks like, and how to continue supporting the child all the way through until a connection is formed. This next slide kind of goes into these domains in a little bit more complexity. However, when we look at it from this perspective here, we see those children at the schools who are fighters. They're our impulsive students. And then when you see their families come in because you're trying to have a meeting or something with them, the parents aren't much different. They're just as dysregulated. They are probably experiencing substance abuse disorders. They may potentially be hostile, irritable. And so again, when we're thinking about it from a family unit, and we've got our educators trained in understanding what this looks like and understanding from their perspective, we're better equipped at understanding how to respond. Next slide. We know what trauma does in developing brains. We know the effects that it has on children and the impacts that it can have in education, but these go all the way into adulthood. And so all of these effects, when going unhealed, untreated, they go into adulthood, and we see them in adults who have difficulty with memory recall. We have adults who have difficulty with comprehension, or even just simply suffering from substance abuse disorders. And we see them in our ERs, we see them on our streets in Kern County, walking. We see them in many different ways. Next slide. And the reason why I want to bring all of that up is because we'll talk about it in the next slide. The way that it works, and this is the way that I feel like I could best explain, and understanding how toxic stress really kind of desensitizes us when we experience it in high amounts. So a child experiences toxic stress, whether it be whatever adversity occurs in the morning. They come to school, they're already dysregulated, survival brain is already turned on. So then it's overwhelmed with cortisol already. Then the child is given an assignment, and for whatever reason that they don't understand, they're unable to complete the assignment. And when they start to look around, their body goes into the sense of fight, flight, or freeze again. The survival brain turns back on and says, oh, okay, are we scared again? And because it's desensitized and doesn't know how to differentiate between a true threat and a non-threatening experience, it will just reactivate. And then again, that puts the child in another state of survival. So it just keeps reactivating itself, making it a lot more difficult and challenging for that child to be able to regulate. Schools are in the best advantage to help supporting this child, not only to relax and regulate themselves, but to learn to manage it and learn to understand what their body is experiencing and how to turn it off. Next slide. Trauma-sensitive supports. Again, I'm not trying to simplify and say that, oh, it's super easy. No, but when we understand what it is, what it looks like, and how to implement with fidelity, these core standards of supports become a lot easier and stronger, and are able to help heal our children, and can be done in all of our classrooms, all of our libraries, all of our hospitals, clinics, you name it. These trauma-sensitive supports can be implemented and put into place in any setting that support children. So when we think safety, we think attachments, again, there's that word, right? Relationships. Then we have opportunity to strengthen those non-cognitive skills. Next slide. So the connection between school and building community resilience. When we think about it from the perspective, again, from the outside in, I want us to say, okay, so we don't work in a school setting, and where that's not our primary place. The school setting is one of the places that can help support community resilience. I feel that it is our stronger stance merely because it's where our children spend the majority of their time, and it's where they have more opportunity for social interaction and building that social connection. When we don't put our schools in a position to succeed in helping support our children who have experienced ACEs, then we have outcomes that are not going to be, well, they're not going to be the best outcome for not only the child, but for our community as a whole. So we know trauma impacts school performance. We understand that it can affect certain parts of the brain and the learning centers. Well, it also causes illness, and it also causes psychological impairments. And when we think about that, we can then connect that. We can think, okay, well, when those types of things happen, then we've got our overcrowded hospitals, then we've got our untreated medical disorders, we've got addiction, and we've got early death. When we think about it from, our judicial system, those children who feel inadequate, who never receive the services that they need, they end up incarcerated. So then our jails get filled. And then we've got the other two where we end up, children who get put into the child welfare system end up having children who get put into the child welfare system. So it's that perpetual cycle. When we think of it from the other side of, okay, we're going to put these trauma-informed practices in place. We're going to ensure that we educate our educators. And I mean, everyone is an educator who works in a school. The aides, our janitorial staff, our bus drivers, everybody. We're going to learn to provide safety from the moment we pick up that child through those bus routes and those libraries. We're going to provide knowledge and understanding of what a dysregulated system looks like in our schools, and that's through our social emotional learning curriculums and our social skill development courses. And then we're going to implement trauma sensitive practices that reduces the chances of the other systems being part of that child's life, such as the judicial system, such as the child welfare systems and things like that. So we see what the potential outcomes can be when we think about it from both sides. Next slide. So then we ask ourselves, okay, so what is a trauma-informed child and family system? Well, it's one in which all parties involved recognize and respond to the impact of traumatic stress. We put together a system, again, with fidelity. We're training. I know our school social workers are doing amazing at providing what the foundations of trauma-informed care are. So everyone's like saying, oh, it should be a required course. It should be this. No, to some degree it is. Most people have access to these trainings and it is not a requirement. Nonetheless, though, the knowledge is being put out there. And so like that beginning slide I talked about, we're in step one, right? We're bringing in awareness, and to some degree in step two, where we're training some of our educators. But it's now we need to get to that piece and that component where we're learning to recognize and respond with fidelity. So programs and agencies within such a system infuse and sustain a trauma awareness and knowledge and skills into their organizational cultures and practices and policies. When we get there is when we will maximize the physical and psychological safety and facilitate the recovery of the child and family. And so that's how we build a stronger community and a resilient community. Next slide. Woo, I think I did it.
You did it.
Thank you, guys.
We put you through a lot there, everybody, and we did have to move quickly. We do encourage you to, you can go to Whova and download the presentation and have it all to yourself right as of today if you have registered on Whova. If you haven't, download the app. It's very, very simple. Doesn't ask you a lot of questions, doesn't cost anything. And you'll just go to the agenda and be able to pull all the presentations together. And we hope that this has been helpful to you today, even though it's been a very quick review of a lot of this information in 1 hour. Any questions that you guys have before we have to break?
I see Heather's question here, and this is a really good question. And this is one I'm working on within the school district I'm currently at too. She says, my question is, let's say we move to phase 3, where everyone at the school level is trained. How do we connect this universal tool outside of the schools? There are many agencies that are not talking with one another. I think, and this is my opinion only, I think we're still in, the beginning phases within our community where this is learning to become a standard where we're talking to each other. And it requires some of us to have to go and do more above, I think, our roles. So with that, I'm saying, for instance, as a foster parent, I have a child who's receiving mental health services and he's got the connection, but there's a disconnect between his school and the behavioral intervention services that he's receiving outside of school. So it was me seeing that disconnect and finding a way to tell the therapist and the behavioral interventionist, please reach out to the school social worker and ensure that whatever sources of support that need to be implemented can be taught to the school social worker so she could reach out to either the teacher or whatever team is put in place for that child. And so it's like advocating, ensuring that we advocate for our students. So that's how I feel that we can start getting all of the other agencies to talk to each other. And as a school social worker, I reach out to anyone that's on my case that is receiving behavioral health services. I reach out and ask, let me know if there's anything we can do at the school to help support this child.
I want to ask a quick question here. Foster parents are trained in ACEs. That's one of the questions that we have.
They are trained in a very brief ACEs training. Yes, they are. I think it's like 30 minutes long though.
So that could be improved. Would you suggest educators in addition be trained in trauma-informed care, be trained in neurodiverse children?
Ask me that again. I'm sorry.
Would you suggest that educators in addition be trained in trauma-informed care, be trained in neurodiverse children?
Well, absolutely. I think that, again, knowledge is power. The more opportunity we provide for our educators to be trained in many areas that pertain to the health and well-being of children's mental health, I think is a great idea.
And how do they request training? And I'll try to answer that. I think you should go to the resilientkern.org website, and you can send in a request for training of your organization, and let Resilient Kern get back to you on how that can be done. We're hoping we get a new grant so we can do a lot more training the way we did over the last 2 or 3 years. Are they training BCSD and Kern High School District in ACEs? I believe they are.
Yes, and both of those districts, being that they're some of our bigger districts, they have an amazing team of mental health professionals that provide training. I don't know where they're at in that, program, but definitely reach out to your school district's social workers or MFTs or psychologists, whoever it is that leads that. Probably your support service director might be a lot easier, but they can definitely get to your questions and helping you figure out where you can get that within your school district.
Monica, you're saying don't forget about school nurses. We've been training nurses for many years. And some of them were school nurses. I remember when Debbie Wood was still with BCSD, she had all her nurses participate. But that's why Resilient Kern is pushing to continue to do the training. We want to change a generation of children and reduce by half the number of ACEs that are experienced so that we don't carry this terrible, terrible stress on from generation to generation.
Agreed. And our school nurses play a very vital role in helping support our children who are experiencing trauma, because remember, trauma creates somatic symptoms, and somatic symptoms are often something that gets overlooked and we send children home for. Remember, school is the #1 space for them. It's safety, it's ensuring food. And so we want to help them through that somatic symptom and ultimately get them well enough to get right back into class. And our nurses are the ones who will respond to that.
We've only got a couple minutes, but we'll try to answer all your questions if possible. Is there any form that tracks improvement to the family after the schools or organization has responded to the trauma? Well, I think there is evaluation work that's done. And I see, Gloria, that you're a DR person. So you're doing that frontline work that's so important to help families.
Yeah.
One of the ways that we've done it through our training is to interview workers to find out what their reaction to the training is and what their experience is with it. So maybe we'll interview you.
All right, I think we're just about at our time. I wanted just to provide a couple of closing remarks. First, I wanted to thank Mr. Thibault and Ms. Guzman for all the wonderful information they shared with us this afternoon. And certainly all of the attendees, I want to thank you for making space for us in your busy day. We so appreciate it. Your information will help us as we move forward, mitigating toxic stress for families and moving the ACEs work forward here in Kern County. As Mark had alluded to earlier, we ran a little short on time, and I'm sure there may be some other questions that you have not had an opportunity to have answered. As Mark said, you can go into the Whova app and you can put your questions there, and we will be researching all of those and getting back to you with answers to your questions, or connecting you to additional resources. And how you do that is, once you're in Whova, you can visit the community tab and search what